Well, let me first thank our sign language interpreters. Thank you very much. We're grateful for what you and your team have done and making it so that those who are hearing impaired can hear our press conference and hear the questions and hear the answers. So we are very grateful for that. Thank you. In a moment, Dr. Acton will bring you up to date on the figures that we have. Each day, what you're seeing is what we expected, which is the number of confirmed coronavirus individuals who's been confirmed that they have this will continue to go up. You'll see they've gone up today. We have more testing going on. We're seeing more hospitals starting to come online in their ability to test, and that will also continue to increase the numbers. But again, this should not alarm people. We knew this was coming. We knew that there were many people out there who are positive, who would test positive if they were tested. Many people already have this virus and are walking around in Ohio. Many people are spreading it, and many people simply do not know they have it, and some of those individuals will never know they had it. So this is the nature of this virus, nature of this problem. Again, the summary, as we caution people to be so very, very careful. You don't know who has it. This is just the very, very nature of it, particularly the young. They may not show much signs of this at all, we're told, but they certainly have the ability to spread this. Twice as contagious as the flu, and we all know that the flu is very, very contagious. It's also 20 times more deadly. Let me now ask Dr. Amy Acton to come up and give us some figures and some comments. Amy?
Okay, thank you, sir. Let me start with our figures for today. And we have right now, as of our last testing batch, we have 26 confirmed cases in Ohio. So we started at 1 on Monday and we're now at 26. The illness onset ranges from the 7th of February now to the 13th of March. The age ranges are 31 years old to 86 with a mean age of 53 years. So it's my age. Sex, 12 females, 14 males, 7 hospitalizations, and 0 deaths. There are a number of counties involved. I'll let all that be on our website. But I'll come up and give some more information after you, Governor. Thank you.
Amy, thank you very much. We talked about, and some of you had the opportunity to see the call center, and as I told you after I saw it, I thought people needed to be spread out, and this is kind of a message that we're sending to people in the workplace. If they continue to work in the office, spread out. And we now have 25 people working in the call center. That number continues to go up, and we continue to add to those numbers. So far, we've received 18,000, that's 18,000 calls, people asking for information. As of today, between 9 o'clock and 12 o'clock, we had 1,400 calls. So 1,400 calls as of noon today. Again, we know that some people are calling and not immediately getting an answer. We would suggest that people go up online, coronavirus.ohio.gov. That's coronavirus.ohio.gov. And those would be a lot of the information is actually up online, and people can get that. And so we would suggest they start with that. If they still have questions, they certainly can move on from there. I'm going to cover a number of just kind of miscellaneous things as we go on here to keep you up to date on what's going on here in Ohio. The casinos are closed. The racinos are closed, but the horses on several of the racinos are running. So that continues. Let me comment. We've had some questions about visitation or visiting at nursing homes. I want to clarify the order. The order does make an exception for end-of-life situations. That includes family and clergy. That is end of life. So again, that is an exception that was written into the rule that we wrote. We did not specify clergy. It was implied, but we want to make sure people understand that, and nursing homes understand that clergy is included for end-of-life situations. Let me revisit the issue of daycare. Again, social distancing is a key. Daycare settings, virtually impossible to have social distancing with 2-year-olds, 3-year-olds, et cetera. So the recommendation from the doctors is that if you have the ability to take your child out of that setting, you should do so. Yesterday, the Department of Health and Jobs and Family Services was on the phone with about 1,500 daycare providers going over rules, regulations. They have put out specific guidelines, enhanced guidelines in regard to sanitation, sanitary rules, also strong suggestions in regard to, if the setting allows it, the compartmentalization of children. In other words, if you have kids that are only together with each other, and then another room you have kids, so there's no intermingling. If there is an outbreak, then at least you've confined it to that particular room and the children in that particular room. Again, this is common sense, but it's important to emphasize. Let me talk for a moment about mental health challenges. I'm going to ask Lori Chris to come up here in just a moment. What we know, and the professionals know from looking at past pandemics, is that mental health challenges go up. This is a difficult time for people. So again, we would emphasize take care of each other. You know, there are things that, even though we don't want to have people to have physical contact, get too close to each other, but there's still the telephone. There's other ways to communicate. If you've got a neighbor who is isolating herself or himself, and maybe they're elderly, if there's ways to reach out to them, maybe provide food. Their life has to go on, and I guess the message is if everybody could take care of everybody else's grandmother and grandfather in the community you live in, that's probably a very, very good thing. And as I said the other day, we just, we really, really have to take care of each other. We are seeing a lot of people who are stepping up and really wanting what they can do. And I'm going to ask in a moment Lieutenant Governor to talk a little bit about that. We'll have more as we move on. Let me just say, we're in this for the long run. This is not going to end overnight, and so people have to understand that. And as they look at how they're helping friends, and even emotionally, they have to start looking at this. I think we all have to start looking at this as if this is going to be here for a while, because it is. We know that. We have the opportunity to use telemedicine more. We have the opportunity to develop even more distance learning. These are two things that will come out of this. We look at this pandemic with all the bad things, but I think the odds are that we're going to see some of these techniques, some of this ability to communicate with people move forward, and we'll probably never really move back completely. So that's probably a good thing. That is, in fact, a good thing. Let me introduce Lori Chris, Department of Mental Health and Addiction Services. Again, we're concerned as we go through this with everybody. We're concerned with people who have an addiction. We want to make sure that they can continue to get the support and the help that they need. We're also concerned with people who have mental health problems and challenges, that they have the support and help that they need. Lori, I'll ask you to come up, and then John, if you can come up after Lori does.
Thank you, Governor. So no sector of our society has been immune to the impacts of this public health crisis. And one area that I'm primarily responsible for in the governor's cabinet is behavioral health, so supporting those Ohioans with mental illness and with addiction issues. This system has been taxed heavily in recent years already, taxed in terms of stress that they're experiencing and meeting the needs of Ohioans with these conditions. And so this behavioral health system is what we're making every effort to support. This week, the governor looked to my team at the Ohio Department of Mental Health and Addiction Services, we also call it MHAS, and the Recovery Ohio team with Alicia Nelson and her leadership, and the many other agencies who work to make sure mental health and addiction needs are met for Ohioans. As you know, a few days ago, I executed an order that discontinued in-person visitation of patients in the state's 6 psychiatric hospitals that we operate at the state level. We've made every effort to ensure that there's continued telephone contact between patients and their visitors, and we're working to make sure that there's video visitation available as well. And as we continue to look at this crisis and its impacts on those who struggle with substance use and mental health conditions, we want to announce the following today. In partnership with the Ohio Department of Medicaid, we are filing emergency rules to expand telehealth options for individuals struggling with mental health and substance use disorders. These new rules will allow complete geographic coverage of telehealth services throughout the state of Ohio in every home through just a simple landline. This is important because we know that broadband and cellular service aren't available in every community, and this, in fact, is something that the Lieutenant Governor has been taking on in our state. This also eliminates the need for special equipment to connect through video conferencing. So now these actions will allow professionals and their patients to use normal cell phones and applications like FaceTime to connect through video conferencing in order to receive the services they need to continue in their mental health and addiction recovery. It also allows us to eliminate the requirement that a person be seen for their first appointment in person with a professional. And so if that person hasn't, if an Ohioan hasn't had a mental health or addiction issue or sought treatment for that in the past, and they want to do so now during this emergency order, they will be able to have that first appointment through telehealth rather than needing to be seen in person for that care. These are important actions for us to take to make sure that people can still get the mental health and addiction services that they need, so that we're protecting the patients from potential exposure and the workforce from potential exposure. This is really intended to keep everyone healthy in all ways, not just physically, but mentally and emotionally as well. And we're also committed to everything that we can do to make sure that those struggling with these disorders are able to access the medications that they need. So last night, the Federal Substance Abuse and Mental Health Services Administration approved Ohio's COVID-19 opioid treatment plan. These plans were distributed yesterday to our community treatment partners in the state. And the organizations that I'm talking about offer important addiction treatment, which involves medication, psychological therapy, and other recovery and counseling services. Their continued operation is essential to our state, its citizens, and to our commitment to supporting people affected by the opioid crisis. So specifically, the plan includes opportunities for them to work differently in the regulatory structure to respond to the needs of the patients that they're seeing today and the experiences they're having today. These critical providers are getting guidance on how to manage their operations to reduce risk of exposure for patients and staff, and guidance on how to make sure medication is available to those Ohioans who are unable to come to a treatment center now because of the risk that they may have COVID-19, but will be able to get the medication in their homes. My agency also understands the importance of access to medications through all of the treatment providers and state facilities, not just the ones talked about in this federal guidance. And so our Ohio Pharmacy Services, operated by our department, has worked over the past several weeks to ensure that we have adequate and sustained supplies of medications needed in the state's facilities and for our community partners that access these stores. Our every intention is to make sure that medications are available for people with behavioral health and addiction issues and the other medications that they need for their care in our institutions. So I just want to take a minute and say to all of our friends and families living with mental illness and substance use disorders that it's important to know that we want you to stay healthy and well in all ways, to continue in your recovery, and to follow the instructions that we're setting forward, and to know that if you have a mental health need or an addiction services need, we're making every effort to make sure your access to those services are in place. We are asking that if you're not healthy, if you're experiencing the symptoms that Dr. Acton and her team are communicating, that you should be working with your healthcare provider, your local health department, and ensuring whether or not it's safe to go to treatment. Call your treatment provider first. Figure out how to get the services you need in your home if you shouldn't be going to the treatment center. But also, don't skip appointments because you're afraid of exposure. We want you to get the counseling and other services that you need. We want you to stay healthy and well in all ways. If you have any questions or concerns, please call the ODH hotline that's been set up and ask. Call 1-833-4ASK-ODH in order to get the individualized questions that you have answered for you and your family members in accessing health care and mental health and addiction care as well. It's everything that, we're doing everything that we can to heighten the increased anxiety and stress that people are feeling too. So I want to talk about that a little bit as well. You know, these are, as the governor and Dr. Acton have communicated so ably over the past several weeks, these are really trying times for all of us, professionally, with our civic duty to one another, and then personally in our own homes with our own families. We're all experiencing new stress, new anxieties, some grief as well, right? So I just know within my own home, there are plans that we had for this week that we are not following through on, spring break plans. My daughter was really looking forward to launching her senior season of softball this week with her teammates, and that's on hold. So we're all dealing with a new way of living that is temporary, but is really impacting us in very personal ways. So I want to share some things that our team, mental health and addiction professionals, have put in place, and to remind you of what we can do to help ourselves feel in control of information and to help manage our anxiety and stress. The first thing is to just reinforce that getting information from a trusted resource is the most important thing. You have to be going to the ODH website, coronavirus.ohio.gov, and if you have individual questions, use the number 1-833-427-5634 in order to get those questions answered. Those are the best sources of information that we can offer in Ohio and are offering in Ohio, and we want you to use those. We'd also urge you to limit your media exposure. We want the right amount of information so that we can feel informed, and no offense to my local media partners that are all here in the room, but it can be overwhelming to saturate ourselves with stories about everything that's happening in the world on a minute-to-minute basis. And so plan time to catch up and stay informed, but also plan time to step away from it so that you can participate in your normal life activities and not overwhelm yourself in information in an unhealthy way. Also, keep doing the things you always do to reduce your stress and feel better. I mean, we all have strategies that we use. Sleeping, eating healthy foods, resting, relaxing with family and friends, watching movies, taking walks or exercising, staying hydrated. These are all things that we should continue to do. We may need to do them a little differently than we've done them in the past, but for a limited period of time, we need to continue doing them so that we can make sure we're staying healthy and well in our emotions too, and just reducing that stress. Also, pay attention to signs of stress in yourself and in your family and friends, right? We know what signs of stress are, but we may not recognize them while we're having them immediately, or we may recognize them a little down the road. But if you find yourself worrying a lot or having thoughts that you just can't get rid of over a prolonged period of time, so maybe a couple of days, that's time that you could reach out to talk to a friend for support or to talk to a professional for support. If you're eating too little or too much, if you're sleeping too little or too much, these are things that are signs of anxiety and stress. And so know those, monitor those, take a break, do something that's healthy for you and your family. If you're increasing your arguments with families or friends or feeling a little more edgy with people, those are other signs. More serious signs, if you're feeling helpless or hopeless, those are times you should reach out quickly for help. We don't want you to feel helpless and hopeless and have thoughts of hurting yourself or someone else. So these are times where you can reach out and get help for stress management as well. And oftentimes when people are feeling increased anxiety and stress, they'll turn to using alcohol or drugs or other substances more to help manage some of that anxiety and escape a little bit. That's another sign that you're not headed in the right direction with stress and anxiety management. So we're saying if you see that increasing for yourself or a family member, do other things for stress management and reach out for help if you need. We've provided the ODH helpline with information about where you can get resources for mental health and addiction services, and so you can call that number. They've got fact sheets on what you can do and who you can connect to at the national or local level for any of the services that you need. Thank you.
Thanks, Lori. John?
Thank you, Lori. That is tremendous advice. And one of the things that the governor has asked us to do, and that we have a team of people working on in the administration, is not only to do what Amy's doing to keep you updated on the latest health issues, but we're also, working on what's coming next. And we know that the circumstances that we face are going to create some social and economic stress in people and families and communities. That's the history of what happens in pandemics. And people's lives have been dramatically changed in a matter of a few days. You ask yourself to look back about how you saw the world last Saturday versus this Saturday, and it has dramatically changed. I know that 10 days ago, our workforce team was working on how we're going to find enough talent and employees for the businesses of the state, and 10 days later, we're talking about the unemployment compensation system and how we're going to make sure that safety net is available for people. In our society today, we have become accustomed, particularly in the last 10 years, to on-demand everything. Through the supply chain that we have, through technology, we're not accustomed to waiting or being inconvenienced. And we are now in a time where that is going to occur. We're going to have to wait. We will be inconvenienced. Our lifestyle, our economic circumstances will be impacted. And as we have been talking about here at this podium, we need everybody to rise to the occasion to help us collectively overcome the challenges that we're facing. The two words that I would use are patience and understanding amongst each other, within our families, and within our communities. And the good news is that the governor has been receiving, that I have been receiving from people who want to help. We've been getting texts and messages and calls. Hey, our church would like to help. How can we help? And how can we safely help? Because we're also talking about about keeping social distance. Some of the things that we would recommend, particularly for those who are younger in the lower risk populations, is there an elderly neighbor or someone that needs your help? There's somebody in your neighborhood that needs a meal. Is there somebody in your neighborhood who's elderly who could use an errand? If you're better situated to provide that service to them, then please help, please do so. The American Red Cross has said that they need blood. Please call them, ask to schedule an appointment, a time for you to come in. This is something that we will have as a growing need. Food banks. Food banks are going to need additional food. Contact the local food bank in your community, find a way that you can help there. And one of the things is just neighbor to neighbor help. As schools, right now I promise you, somewhere in Ohio, there is a mom or a dad who's a nurse or a critical care person in our world who is trying to figure out how they're going to accommodate school being out next week and how they're going to make sure that their kids are properly cared for. If you're in a position to help, do so. One of the things that we have through social media and the other contacts we can make is that we can become a care network for each other, a support network for each other, where we identify opportunities for people who maybe have more time on their hands than they once had, that can be a help to somebody else who is important to responding to this crisis. We know that there is a tendency when a crisis hits to look to yourself. So I say this, so if you've been hoarding things, if you have been to the shopping, to the grocery store, and perhaps you've accumulated an excess of something that maybe somebody else in your neighborhood could use, have a generous spirit. Find out how you can help other people, because we're all in this together. We will continue to update on volunteer opportunities and ways that people can help in the coming days. Thank you.
Thanks, John. We told you yesterday that we'd received a waiver from the United States Department of Agriculture in regard to the delivery of food that our schools get in the federal school lunch and breakfast programs. We have issued guidelines which provide that any child 18 years of age and under is eligible for this food. So this will be administered by nonprofits and by our schools, primarily by our schools, but in some cases we have profit community groups that are involved in this. But the point is that there's no requirement as far as income. This will be available to anybody 18 years of age and under. I just got off the phone about an hour ago with representatives of the dentists in the state, and then a separate call with the veterinarians. I'm going to ask Dr. Acton to come up here, and then Dr. Andy Thomas, and talk a little bit about this from the point of view of what we're seeing in supplies. But our request to the veterinarians and a request to the dentists is that they postpone elective surgery. We would say that to everybody in the public. If you could postpone elective surgery, that is a very, very good thing to do. One, it will make sure that if your surgery involves going into the hospital, that hospital room will be kept open. But also, even if it's surgery that you never would be required to be really in the hospital and have the surgery and then go home, that still will consume some personal protection equipment. that the doctors have and nurses and other health professionals. And so I'm going to ask Dr. Acton to come back up and talk a little bit about that. Amy?
Thank you, everyone. Good afternoon. So first of all, I just want to say, and I really need everyone to sort of focus on this now, coronavirus is amongst us. We know now, and the rapid rise in cases, and in the history of these cases of community spread, we know that estimates of 40 to 70% spread by the Harvard epidemiologist, Dr. Lipsitch, that this is going to spread everywhere. One of the toughest things about this is that many people are asymptomatic. Many people may have already had COVID-19 and thought they had the cold or the flu. And history over time will go back, but the most important thing, we have a lot of talk about numbers and tests right now, but we're way past that. And I think it's important to all my colleagues across the country and to everyone to remember, I've heard words like we're flying blindly. We are not flying blindly. We have science behind us. We have pandemic plans, but we are now approaching that upsurge, and we know that we must employ the mitigation strategies that we have, the tools that we know we have. And that is the things I talked to you about yesterday, the early, targeted, layered interventions. There is no more time. Timing is everything in this. So I'm going back to our curve. And I know this is becoming iconic, but it's so important because we're on the upswing, and a week or two makes all the difference. We're trying to make this a less steep upswing. And I keep saying this, we have to save lives and keep people from being sick. But we also want to talk about the line here. The authors of this curve told me, I talked to them again today, that the one mistake they made is they didn't draw the line in their original graphs, because this is about hospital capacity, and Dr. Thomas will be talking about this soon. But this is absolutely essential, and we know that this virus is spreading, it's doubling every six days on average. And so this slope, we're on that upsurge, and we don't want this. These community mitigation efforts that the governor is taking, and governors all over this country are taking, and it matters, and it is urgent that we're doing what we're doing. The disruption we're feeling is so hard, as Director Chris said, but it's essential. And I'm going to ask that reporters and media help us both with Director Chris's message, but also we need to move our stories to the front lines. Amy Harmon did a wonderful story in the New York Times a few weeks back, and I'm talking to you, Amy, because we've spoken. We need to get out in the communities, because the things that I hear from the front lines are so important right now. So I ask you, go out to those local health departments and find out what is going on. Listen to Dr. Thomas and what is going on in communities. These actions we're taking will make a difference, but we've got to take them now. We do have a compass. We know what we do is perfectly imperfect. And I know it is so hard at a time like this with a flood of media to tolerate ambiguity. There is going to be ambiguity, but I have already seen incredible genius. And when we talk about what our hospitals are doing, I think you'll be very impressed. A lot of you are hearing about, personal protective equipment and the moves we're taking, asking for the limitation of unnecessary or perhaps elective surgeries is essential. The truth is, and you've known this, and you'll be hearing more about it in days to come, there's a limited supply of this. This is the N95 mask you're hearing so much about, and I'll let folks come up and take a look. This is the one that has to be fitted to healthcare professionals. There's different sizing. It's important because you're getting that perfect seal. We have a great shortage of these. You're hearing about a national stockpile. We have some, but the numbers are nowhere near what we will need. We're hearing from the front lines that there's already a shortage. These are surgical masks. They're different. While they don't protect the spread of for the healthcare professional, they are useful in putting on a patient who is suspected so that they don't cough the respiratory droplets onto people. These shortages are real. We are going to see new things in healthcare, new innovations. But the fact is, we are going to be preserving this, and we're going to be making calls and asks and potentially orders come Monday to help us take the ones that are out there in circulation, perhaps in an ambulatory setting, perhaps for elective surgery, and redirect them so they can be used by our healthcare institutions. We've got to take the healthcare situation very, very seriously. Look at Italy. They do have a good healthcare system. This will tax any modern healthcare system, what we have ahead. I want to talk about the 6 feet also. The numbers are coming up, and we're talking about 3 to 6 feet of separation for folks going, but I thought today on the way here about 6 degrees of separation, the Kevin Bacon rule. So Kevin Bacon is going to be used here. But the fact is, what we're doing, these measures seem so drastic, and when you're healthy, again, I drove home last night and was eerily quiet on the streets, and you're thinking, I'm healthy, what does it matter what I'm doing? It is about Kevin Bacon's grandmother. It is about those 6 degrees of separation we all have to each other, and this exponential spread. Every time we go out and about and infect 2.28 more people, as the latest stats show, that those are going out and doing the same as logarithmic. That curve goes up, and we put that stress on the healthcare system. So we've got to think about this in a different way. I know we're not socialized to think this way, but it really does matter what we each do. So I think I'd like to turn it over to Dr. Thomas.
Good afternoon. Andy Thomas. I'm Chief Clinical Officer for the OSU Wexner Medical Center. I've been asked to make a couple of comments about steps that hospitals and physicians and providers in general have been taking over the past week related to the COVID-19 outbreak. I think many of you have seen in both the local and regional sense a number of facilities have put forward swabbing stations, the ability to increase with the access to testing now in the state of Ohio, the ability for patients to become swabbed, essentially to have specimens collected to be tested, are being set up at the local and regional level across the state. Obviously, hospitals and physicians are gearing up for taking care of these patients, whether it's someone who needs to be in the ICU or someone who just needs to be seen in the emergency department, swabbed, and go home. It's an important aspect, as you've heard, about the capacity of the system to make sure that we are doing all of our part to make sure that we're preserving that capacity for the future. Many of our hospitals across the state have begun in this past week instituting visitor restrictions. So I would highly recommend, if you are planning to go visit someone in the hospital, to check that hospital's website to make sure there aren't restrictions either around age, around the number of visitors in any given day or at any given time, to make sure that you're not going to make a trip then that you won't be able to get in and see someone at the hospital. Many hospitals have also implemented screening of visitors at entrances just to make sure that someone who has a high-risk exposure, either from travel or exposure to an individual, or certainly someone who has current symptoms, is not coming into the hospital setting and bringing that virus potentially into where there may be people ill with other things. And last, certainly but not least, as you've heard about the potential concern for PPE, as Dr. Acton has shown you, the hospital medical advisory group of physicians and hospital leaders across the state has been meeting over the past week, and one of the issues we've been talking about is developing criteria for how we limit the performance of elective surgical cases and other types of medical procedures. That really has a threefold benefit to the system at this point. First, it's a little bit difficult in many hospital waiting rooms to practice social distancing. Having fewer people at the hospital makes that easier to do. Certainly, if we can postpone a procedure or postpone a surgery for weeks or longer, and that's not of danger to the patient, it might be the right thing to do just from the social distancing alone in terms of people being near each other. Secondly, as the governor mentioned, if that patient needs to be in the hospital after their procedure, when we can safely postpone it, that will preserve that hospital bed capacity for patients with COVID-19. And third, it preserves these very important pieces of our inventory, because this is what our staff, this is what our patients and their families need to be protected when someone is in the healthcare setting. So the hospitals across the state, under the guidance of the Ohio Hospital Association, are coming together to develop criteria about when something can be safely postponed. Obviously, we would never want to put a patient's health at risk trying to solve one problem by creating another. However, there are elective procedures that if they were delayed a period of weeks would not be any danger to the patient. We want to make sure we do this smartly, taking into account the specific nature of different specialties and certainly the way different facilities practice. So I think across the board, the governor's mentioned dentists, he's mentioned veterinarians. There are obviously a lot of ambulatory surgery facilities in the communities, ambulatory endoscopy suites, and hospitals where we all need to be taking this approach together to make sure that we're preserving our capacity. Thank you.
Sure.
I just want to add one point to what Dr. Thomas was saying. These drive-through capabilities, you're hearing about them. A lot of this is strategic so that we don't bring people in the emergency room. However, it's not a drive-up like McDonald's. You must be screened. There still is limited testing. We're trying to use it for the most high risk. So many people might be told, many of us will end up having COVID and be asked just, don't even get tested, stay home and ride it out like the flu if you're healthy. This is really after you've had that doctor's or primary care provider screening, then you'll be told, where to go. This isn't sort of a option for all. There just won't be that capacity to test for a long, long time. So we're using this very strategically. You've probably read about Colorado. So that's not what this is. Our hospitals are running something in concert with primary care folks.
Good. Thank you very much. And finally, just a comment about kind of endurance. We know there's going to start to be some fatigue of living this way, but I think we have to get our head wrapped around that this is not a sprint. This resembles more of a 2-mile race. It's 10,000 meters, whatever analogy you want to make. Maybe not a marathon, but it's going to be a while. We don't know when this peaks out. We don't know how fast it goes back down. The best estimate Dr. Acton has is late April, early May, as far as when it might peak. So we're going to be doing this for a while, and so we need to kind of get our head wrapped around this. This has been a long week. A lot has happened in a week. We've gone from virtually no positives to 26 positives. Next week, we're going to continue to see those numbers dramatically rise. So I just think we're in this for a long run. We've got to get our heads set to do that. We will have no press conference tomorrow at 2 unless something that is particularly significant and something that we really need to be able to communicate directly to the public. Again, the more that we can distance ourselves from everyone else, the better off everybody else is, and we are, and our family is. So everyone has as Lori said, everybody has sort of their own diversions. I'm not going to give you my book list of suggested books or Netflix. My granddaughter, Izzy, sent me a list of things that you could watch on Netflix. But everybody's got their own way to kind of pull back. But it is important that we in fact, pull back. Disney Plus, whatever. My friend Dan McCarthy, who's our legislative director, who the press team here knows, he reminds me that they're racing tonight. They're racing at Northfield and at Miami Valley and maybe other places, and there's just the horses, but and the necessary people there. So there's no spectators, but you can watch that. I'm told online. So I'll be happy to respond to any questions. Since Jim Oddie had the last question about toilet paper yesterday, I'm sure he has raised his hand and back and would like to ask a question. Mr. Oddie.
Dr. Acton, you got the list of counties, how many cases of confirmation we had in each county? Do you have that list?
I do have that list, and we'll put more on the website. Right now, we're working really hard to make sure that folks are saying the county where you're tested, and different people fill out these forms, so I'm working on clarifying sometimes where someone lives and not. So that work is being done, but what I was given was Belmont 2, Butler 4, Cuyahoga 11, Franklin 1, Lorraine 1, Stark 3, Summit 2, Trumbull 2. I can tell from what I've heard on the ground or by folks calling me, there are other counties implicated, so I'm thinking sometimes they're listing where they're getting the test and not always where they actually live, so we're working on that.
So can we get some clarification on the masks? Are you asking veterinarians and dentists to like forego their supply to hospitals, or?
If they have extra, we would like to get them in. We would also ask them to forego the elective surgery, and so both of these things would be helpful. Amy?
Yes, so we'll have a lot more details at a press conference, which we will have on Monday. We have a group of, again, it's been just a privilege to witness the ingenuity and creativity, but all the hospitals are working together. Primary care docs, all these folks are thinking strategies. They're working with our EMAs and our emergency preparedness people. So what we anticipate, and we're toying around, as you will see in every state, ideas like people bringing in the mask potentially to the EMA sites, and we're looking at even ways we could cover those costs of what folks paid. Again, no price gouging, none of that. These masks are vitally important in the days ahead. And you know, the stockpile with the reliance that we've had on this being made in China, I'm sure the distributors can talk to you about it. We've been in sort of not a rationing, but we're conserving. And folks have already implemented all those measures for weeks. Weeks ago, we started that process. So this will become more of the story as time goes on.
Is there any ability for manufacturers in Ohio to like just start producing these?
That would be a great question for the distributors, but I'm understanding that you know, that is not something that could turn on a dime. So you know, these measures we're taking, I know they feel a lot MASH-like. They're actually scenarios that have been planned for in pandemic plans, and we sort of play out how we do this. So we have a playbook, but then each state and each locality is a little bit unique, and so we're working with the leaders throughout all these industries, and that's what I want to say. You know, we have got to focus on the people of Ohio and what they need. And there are so many people out there making new policies, breaking the rules. These things will not get in our way. We're going to use ingenuity, and we're going to maximize everything we do.
Governor,
We did, just to clarify one thing, I don't think I said this, we have received our shipment from the National Strategic Stockpile. So we have in fact received that. And just one editorial comment. Once we're through this, and we will get through this, there needs to be some national thinking, all of us, about never letting us get in a situation when we don't have the capability in this country to produce things that we need to produce in case of a crisis. The idea that we're scrambling now, and look, it's going to work out, but the idea that you know, all this stuff comes from China is just outrageous, and we should never let ourselves get in that position again. And I'm not blaming anybody. This has just occurred over a long period of time. But we have to, after this crisis is over, we have to think, what's strategic? What do we have to be able to produce? What do we have to have the capacity to ramp up in this country? And certainly, these guys are part of that. Who else?
So we've been hearing from a lot of people who say they feel ill, they've called their provider, and they've decided not to test. I know the criteria for testing has changed in the last couple of weeks. What today is the recommendation for who should be tested? You know,
we will be putting out more guidance, and I do believe some of that is coming out Monday. And there's also a health alert going out today. You know, this is a transition. I've always said all along, we'll eventually get to a place where we actually be talking, we won't be following PUIs as much because we need to focus on the cases now. And this is typical. Once you're out of that containment phase I keep looking because there's 6 phases of a pandemic. And once you're out of containment and we know there's community spread and we're going to these mitigation strategies, you know, it's not of the greatest public health benefit anymore to go after every PUI. And there's just, the numbers are, you know, they were way above 250 the last time I checked. So that's not even physically possible. So we assume that community spread. And similarly, physicians will start to listen to your symptoms the way they would with a cold, or they don't always do the swab for the flu. They assume you have the flu, and they might say, you know, it's a benefit to just stay home and treat it with the comfort measures. So I anticipate doctors will be saying that, and I'll say that to patients out there. Again, most of us, the good news is most of us will experience this in the usual miserableness we experience a cold or, you know, the flu. And it's okay to ride it out at home and not expose other people. And that's where you might do this self-quarantining. You might stick to your own bedroom and kind of keep it from the rest of your family members and take all those old things we've been talking about all along, the hand washing, the distancing, because we can just assume there's a chance you might have it, but it really won't make any difference in your course. But it is the high-risk groups, and remember who they are. You know, it is our elderly, but as we've said, it is a much more deadly thing. So no matter, even if you're healthy, it is our people who have pre-existing health conditions. Let me add that to diabetes, heart disease, respiratory, obesity even. We have people who, you know, are in dialysis. There are folks who have underlying illnesses, even children who are immunocompromised or have an underlying illness. You know, that's, you know, talk to your provider. They will treat you a little bit differently as they do this history. And if you're feeling a rapid change, so, you know, you're going to have some cough. You might have a little bit of that feeling of not feeling good when you're breathing. But if you really start to have difficulty breathing, no matter who you are, even if you were previously healthy, that's when you take action, you do something about it. You call ahead, as we've always said. We don't, you know, don't go into a waiting room. Call ahead first so they know that you're suspected, and they'll whisk you into a room and close that door. And the healthcare providers will remain protected. Similarly, even you can call ahead to go to the emergency room, and that's a good idea as well. Let them know you're coming, and they'll whisk you in a different way. They're screening at the door, and they'll just whisk you into a special negative room.
Do clarification on the elective surgeries. Is this all elective surgeries, or just for pets and dentistry?
Well, we will promise to bring all of that to you probably on Monday. We're suspecting that work is ongoing now. There are task force sort of sorting through all this nuances of that. But I think what the governor was saying is start thinking about this if you're out there, if you're in an ambulatory setting. We've already had some calls with some of the professional organizations to just give them a heads up, because we want them to help us with solutions too. And again, this is a time of extreme creativity. So we've, you know, every time we talk with a group or a sector of our society, the businesses are having amazing ideas right now and also coming forward asking to help. So we, you know, we'll be working with dentists. We won't be just putting something down on them. We're working with them to kind of figure out the best solution.
And Dr. Acton too, how effective can Ohio's orders be if other states aren't going to the same lengths, and then those people could just be coming in and out of Ohio too? Can Ohio's order still be effective even if other states aren't taking it as seriously?
It's mine. So remember that my underlying rule of 80% is good enough. Everything we do in mitigation, even in containment, as you see, is leaky. As a matter of fact, a lot of the modeling was done, took the leakiness and the imperfectness. That was my Swiss cheese, and you know, that was Dr. Carter Mecker's. Like, he and I had been on the phone, so he went out and talked Swiss cheese, and I'm like, Swiss cheese will never be the same now. But that was our way. We were like, how do you explain this layering effect of any one thing is not perfect, but when you layer them, you get more. And we'll take all we can get. We're maximizing it. There will be people wandering around, still spreading it. There will be people who don't listen. They will not take my advice. Imagine that. And so, you know, they're not, you know, and it's dawning in awareness in people, because this is really hard to get our heads around as a society. So it's not going to be perfect. States are getting there. States, each state, a lot of this is up to states and localities. And we all know the playbook. but we all have different restrictions. I mean, and I'm blessed to have a governor who's, he knows what the right thing is and he's going to do it, and he understands that timing is everything. So you'll see that everybody inching there, and you're seeing that around the world. It's just, it's perfectly imperfect. It's just we're all getting to that same place because we're all, there's no denying community spread is amongst us. So. Yeah, please.
That's a terrific question, Andy. I think that one of the things we've seen just in the past 4 or 5 days, the American College of Surgeons circulated to surgeons across the country a sense of this is coming. Now's the time to work with your leadership of your hospital, your facility, your partners to determine those criteria. The Center for Disease Control has a list of things that hospitals can do to mitigate the outbreak. And that's amongst the things on that list from the CDC relates to elective cases. So we've seen some hospitals in the state of Washington and in California that have had to implement some of these things already. At this point, we're trying to get ahead of it by having criteria in place that people can understand within healthcare professions, within hospitals, and then the trigger point at which we start doing it is a different question. It might be a week from now, it might be sooner, it might be later. But we're working just to be prepared.
Here first.
Governor, you've said at this point that it's just a suggestion that parents keep their children home from daycare if possible. Is there still consideration that you may say to daycares, you need to close because of, little kids can't social distance, they're going to be all over each other?
Yes, that's still certainly a consideration. Trying to take this thing one step at a time. What we hope is that parents will be making these individual decisions based on the best interests of their children and other children. We also know that some cannot. And so those who cannot, we would hope they would work with their daycare, again, to figure out maybe there's a way in that particular daycare to separate kids, a group here, a group here, a group here, depends on the size of the daycare. So just trying to take practical measures. Again, as I said a few days ago, government can't do all of this. Government shouldn't do all of it. In fact, what individuals do collectively is a lot more important than any kind of rule or any kind of order that we can put out.
Governor, daycare is another intervention that you could do. What other layers of Swiss cheese do you have in your fridge?
Well, I will tell you the truth. I posed that to our team today, and
we absolutely did.
I ask that question every day. No, well, it's whatever else we can do as far as that intervention. Look, we're on 2 tracks now. We're on a track of what else can we do. 3 tracks. One's education. We got to do that every single day. The second is, what can we do to separate people more? That's very, very important. Amy, you got something on that?
I was just going to add that, that is exactly the questions the governor is asking. And that playbook, we were on the phone. I spent a bit of time, again, today again with the experts, Dr. Carter Mecker, Dr. Rajiv Venkaya, talking about this because, for the people who have thought this through, we're talking about things around transportation. We're talking about things around labor, for instance. There are things that folks not everybody cannot work and not everyone can telecommute. And so what are we going to do inside businesses? Because those production lines of certain things, including medicines, are very important right now. But there are ways you can, for instance, stagger shifts and the kinds of moves. So there will be it's called cascading effects. It actually has a term. And we keep going through those layers of cascading effects. But in the end, the timing is everything. The sooner you do, a week makes all the difference in this. That's where we are now. So, we can't hesitate, and we keep doing as many as we can, as fast as we can, as responsibly as we can, because all these things have unintended consequences and risk benefits. It's a lot like, the way Dr. Thomas was saying, that another sort of analogy that Dr. Mecker had shared with me is it's like hurricanes coming. Like this, to me, has been this long, slow tsunami coming. I know it's a tsunami. There's not going to not be one. I want it to be a smaller tsunami, not a big tsunami, but it's coming. And so we're doing everything we can, thinking 5 steps ahead and working our way back. And it's like that hurricane preparedness. You want to do it you want to evacuate while the sun's out, because it's very chaotic to try to do it in the middle of the storm. And so we're getting a little bit of the rain, and the rain's getting a little heavier. And so we're trying to stay a few steps ahead.
Are there any plans for economic recovery as a result of this?
Well, Governor has a team of us, working on this, and we've been reaching out to the business leaders of the state, small businesses, large businesses, to not only look at how we're going to address their needs, but also their employees. There are some ways that we are looking at trying to help make sure that they can retain their employees, encourage some of them to do job training during this period, a variety of ways that we're looking at, and we'll have more of that forthcoming. But these are the kinds of things, as the governor has said, look, we know this is coming. We know that there are things coming our way. We're looking at how we're going to prepare for those issues, and we'll have more of that in the coming days.
Lieutenant Governor, to follow up on that, you did mention the unemployment compensation fund was something that's kind of on your radar. Do you have a fix for that yet?
We're working through those issues as fast as we can, and when we have ideas or solutions, we'll talk more about them.
With the graph here, what is the level of the top of the yellow, and what is the top of the blue? Like, how do we know which one we're in?
Wouldn't that be the wonderful thing to know an exact number? I mean, it's so interdependent on so many things, and in retrospect, we'll look back and we might be able to say that. And in some ways, we'll never know all those answers. Right now, people have had coronavirus likely for a while. We may have even had deaths, even here, like they saw in Washington, people that had been diagnosed with something else, like dying of the flu, when they went back and tested the samples, they had coronavirus. So there potentially are even deaths in places that, when we can go back and we do look at all our surveillance data and other things, we'll know. So this is going to be very different in each community. It's going to be different around the world, but it's going to be there somewhere. And so we can't hedge. I mean, we've got to just do everything we can to flatten the curve.
I mean, is this more of like a theoretical tool to educate the public, or like?
This is actually how the data will sort of skew out. Probably won't be like. There are actually times in pandemics where things dip and come back. So this wave might actually be curvier, but if you step back, it's flat. So the data will skew out this way, but it won't be.
But we'll know it after.
Yeah, and we'll see it as it's happening a little bit too. But again, I told you yesterday, there'll be huge postmortems. We'll learn a lot. In a way, this is sort of like a war on a virus. When I think about it, we used to talk, there's so many ways it's not like H1N1 as well. But I think it's sort of like that wartime ingenuity. It's a silent enemy, but it's one we have in common. We have it in common, possibly all over the world eventually. And it's something we're all fighting together, which is the nice thing. And there'll be all sorts of innovations that come out of this that I think will be lasting changes. There are fixes in my bureaucracy that I've loved to fix all along, a technology one or something, and boy, in a crisis, people manage to fix it. So there will be ingenuities. I joked about, there'll probably be a baby boom, but I think that's the kind of thing we're looking at right now, and that's the reason why we need the unity that we're talking about.
Is it possible to have flu and coronavirus at the same time?
Yes, I've heard from some studies it is possible, but that the studies, again, I have to say to everyone, hour by hour, new studies coming out all the time. And we'll try to share some more of that data next week with you, what we do know. I really want to talk to people more next week about what we do know and what you can do. What are you allowed to go do? Because I think we need more of that.
Dr. Acton, how closely are you monitoring what other states are doing to kind of take cues from them? I think Colorado has asked all recently retired medical personnel to, make contact back with their former employees or employers. Are you in the process of doing that? Are we not there yet?
I hear that maybe the microphone is not working. So absolutely, I've Kentucky just called, Dr. Stack just called me while we were up here. We're called SHOWs, State Health Officers, that's from the name. And we're on the call all the time together, asking each other, what are you doing? What are you seeing? And there are many, many similarities. And I will crib or riff off of anyone's good idea. So, and that's helpful. And going to experience people who have lived through this before. You know, I'm not alone. You know, what the toughest thing for me is I'm not going to talk to you like a modeler. I'm used to talking to patients. I am a doctor. Preventive medicine is my background. But, you know, to me, I think the most important thing has been trying to break this down into something people can understand, because I'm much more worried about the folks who are reading what you're writing or seeing this to understand what it means for them.
Okay, well, Jim, you get the last question again.
Thanks. The President mentioned the potential for future limitations on transportation, especially mass transit. Is that in your playbook somewhere, that you might be working with transit systems in Cleveland or airports?
Look, there would be nothing that we're not looking at, that we wouldn't look at. That doesn't mean necessarily we're gonna do it. I mean, you know, we actually had a little discussion about mass transit today among our team, and you know, we have to keep in mind that this is the transportation for some people, that they have no other transportation. So, you know, these are things that we have to constantly try to balance as we look at this. You know, as I started to say, I mean, you know, we look every day, you know, we're looking at how we can better get information out to the public. We look at what we can do better in regard to separation. And we look every day, now it's really kicked in as, you know, we've had the closures. We look at how do we try to help people who have been impacted by that. And that's an ongoing process. There's nothing magical about it, but it's certainly something that we have to try to look at and work on every single day. And a number of members of our cabinet are working on different things. So have a good weekend, everybody. Thank you.